On this episode, we'll talk about the sense of smell. We'll also talk about restarting your own medication, and we'll talk about taking steroids after your surgery. Hello everyone, I'm Dr. Alvarez from Endobariatric.com, and welcome to episode 88 of the AskDrA show. Thank you so much for sending me your questions. If you are new to the show, two ways to do this. You can always submit your own question to the show by just placing the hashtag AskDrA or through my Snapchat account. Let's get into the questions.
I feel like the smell of things is much more intense. Why is this?
All right, so the sense of smell, two things may vary. This is right after surgery. It could be the sense of smell and or the sense of taste. Your taste buds may change, and we've talked about this before, but this is just normally temporary. So the sense of smell, specifically the first few weeks right after surgery, and as their stomach settles down, the swollen tissue comes down, everything returns to normal, everything, your smell, your taste buds, everything comes back to its own self.
How soon can patients have medications after surgery?
All right, so when can you restart your own medication if you are, let's say, with anti-inflammatory, or you're taking high blood pressure medication, or you're taking diabetes medication, or your thyroid medication, or some other medication that you are used to taking. So we normally restart the medications right after surgery, but always run it through your doctor, your surgeon, because there are some medications like certain anti-inflammatories, certain steroids, that we're going to talk about that on the next question. You got to be very careful with those. So always you're going to start taking some medications, you're going to restart your medications, always run it by your surgeon. Now, but regular high blood pressure medications, for your diabetes or thyroid medication, that we normally start after 24 hours after your surgery.
Are we allowed to take a regimen of steroids?
All right, when can you restart taking a regimen of steroids? Be careful, all right? So steroids with a stomach, a regular stomach, with a sleeved stomach, it can put a hole in that stomach. It can create an ulcer. Steroids are known to make that little inner layer of the stomach very thin, causing gastritis and even ulcers. So you have to be very, very careful. By taking steroids, you got to let your doctor know, your surgeon know, even the doctor that prescribed you the steroids, that you do have a sleeve gastrectomy, you have a gastric sleeve. You got to be extra careful with that stomach. So it doesn't mean you can't have the steroids. You can have them for a short period of time. Let's say for an allergy, or for as an anti-inflammatory given by an orthopedic surgeon or some other cause. You can take steroids. Just use caution. All right, so that's it for episode 88 of the AskDrA show. This weekend, Chattanooga, Tennessee, it's March 11th, we'll be at the Embassy Suites. I'm looking forward to seeing you there. And again, big favor, yes, I'm talking to you. If you enjoy the show, if you think it has you think it's useful for other sleevers, just share it to Facebook groups, to a friend, somewhere where there's somebody else, some other patient that can benefit out of the content. Thank you so much. I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.